Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Had a patient refuse to admit he swallowed a pen. Even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. I'm vet student. Many clients like to say I don't overfeed my dog cat. That's just their normal size. When their pet looks like a watermelon. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to heal her eventually, but she just wanted to get rid of the migraines because they're giving her a lot of pain in her last months. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. Only work records in a clinic, but we had a woman come in with a report of vaginal odor. All well and good. It happens all the time in an obgyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. I want to make sure I'm understanding this clearly. She had a tampon stuck in her vag for 7 years? I didn't go into her chart, but according to the medical assistant that was in the room, yes. The rest of us needed no more proof than what our noses found in the hallway. Not a doctor, but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in ER. No maternity ward in their hospital, and she was in advanced labor when she arrived, and she still insists she's a virgin. Edit, poor wording. My husband was the doctor, not the 17-year-old girl. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids, they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank. Even when I remind them it's very important, because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites. But one kid walked in eating a bag of Cheetos at reception, and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for coke. After the rest of his cardiac workup was negative, I said to him, "Good news. You didn't have a heart attack. It's likely that your chest pain was caused by coke." His answer, "I didn't use coke. See, I was at a party and people had some lines of coke out on a table. As I was walking by, an oscillating fan blew the coke into my face, which is why my urine was positive. MMMHMM. Got it." All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married. To be fair, the patient's mother was there, and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. Had a patient in hospital. I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM. Massive pupils. Couldn't sit still. We asked him what he'd taken while he was out. Nothing. He swears. He went to the pub and just drank lemonade. Okay. We say. We're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed. But he insists he didn't take it. His drink was spiked. Other than all the random things that end up in rectums accidentally. Drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug tox screens we do that come back positive for something and everyone is shocked. Borderline offended it got into their system. One of my lecturers told us a story of when he worked in ED. There was a man who refused to acknowledge or tell them how a jar got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL, blood sugar level, was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking, he told them the jar was full of honey before it got lodged and was rapidly absorbed by the rectum, causing the insane levels. What? Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. I was once marked as pregnant by mistake when I went into the ER. They were talking about the tests they needed to run. But they couldn't give me medication because of the baby. At that point I said, hold up. There is no way I'm pregnant. The nurse looked at me and rolled her eyes. I told her that I've only ever slept with women in the last couple of years. So there was no way I was pregnant. One of the other nurses reran the pregnancy test. And turns out I wasn't pregnant. I am a doctor. Not a single random thing up my ass is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother. And that's why they are sterile. If you aren't aware. This is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus we found a snack wrapper in the inaccessible folds of your panis. Jeebus. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse. And you physically saw them smoking outside before they came in for their appointment. That's not what annoys me though. What annoys me most is that patients will Google what they think is their diagnosis. Admit they did. Get their diagnosis right. Then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it. Read the Wikipedia article. Then still come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. Edit. Roughly 80% of what comes into urgent cares can be managed at home with do nothing, rest, drink fluids, take Tylenol. Maybe not so weird because the person was whacked out of their mind. But once had a patient who was clearly on drugs and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ED regularly. While I was drawing their blood, the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out, they were tripping gonads. But underage and refused to tell us anything for fear of their parents finding out. You weren't breathing. We gave you Narcan. You started breathing again. Woke up. And then deny you used a narcotic. Yeah? Alright. Med student. Went to see a patient for my practice physical. These are all volunteers and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up and he didn't move it. So I asked him about it and he was like, "Nah, it's fine." See, and proceeded to move it like a 1/2 inch. It clearly was not fine. I'm sweating now cause these are mainly just opportunities to talk with patients and they are supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me. But I was ready to call in a real doctor cause I was freaking the duck out. The dude really did have a stroke. It was 15 years ago and only affected his one arm, he just liked to pretend it was fine. Once he made that clear, the rest of the history physical was great. Kind of the opposite situation. But I had to go to the ER because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant and I said I am sexually active. But I just finished my period. So it was unlikely. She just stared at me for a second and starting laughing. Apparently no one ever just admits they have sex and always tried to hide it. For some reason. Turns out I had a kidney infection anyways, lol. So in my story, I'm actually the patient not telling the doctor something. But I felt like it was good enough and relevant enough to share. But when I was like 13 or so, I ended up with a urinary tract infection. Which was odd because I'm a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great. But if you pump air up there it makes a mini fart sound when it comes out, so I guess that's a plus. Obligatory, not a doctor. I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR, we ask them a series of questions. Including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because you know, brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. Not a doctor but work in an ER. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as shit, lol. That they can't afford their meds. Yep. America. It's so weird. We can for sure tell you weren't taking them. It's put your life in serious danger, and if you don't fess up it could kick you off the transplant list for non-compliance. It's such a taboo, I guess, to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple, doc, I just couldn't afford that and food, but it takes some work sometimes to get people to just tell us that they had maggots in their foot wound. Patient with diabetes came in to see me in clinic. Said foot had a wound. I asked when they last looked at it. They said that morning, and this was an 11 AM appointment. Helped them take off their sock. There were 4 maggots busily cleaning a pretty large ulcer on the side of the foot. I threw up a little in my mouth and proceeded to remove the maggots and dress the wound. A damn clean wound due to those maggots.